Hello and welcome. I am Tim Katsalis, and I will be talking about the triple hop for distance test following ACL tear as a functional performance indicator. The anterior cruciate ligament tear or rupture is a common injury in sports, with over 125,000 reconstructions performed annually in the United States. These are typically associated with twisting, cutting, jumping, or landing movements, which are required in athletic activities. Reconstructive surgery is the universally preferred route for athletes who are looking to return to their prior level of function. However, some people who experience an ACL tear opt not to undergo reconstructive surgery when they aren't involved in returning to a competitive sport. As we already know from past studies and clinical experiences, the rehab process for athletes is rather extensive, lasting upwards of 4 to 6 months when return to sport becomes considered. However, return to sport is not always guaranteed after surgery. There are many factors such as age, sex, body mass index, additional injuries, and even confidence, which may influence outcomes. Once we approach the end of the rehab process, how can we determine if our patient is ready to return to sport? One effective measure is the triple hop test for distance. This test is a performance-based measure in which the therapist observes the patient perform an action that is related to sport activity. The triple hop test for distance is a single-legged hop test which combines several systems such as strength, neuromuscular control, and balance. Although a hop test cannot provide sophisticated analysis of limb function that can be obtained from force plate studies, hop tests appear to be valuable as a general screening assessment. This can be performed in a clinical setting, does not involve expensive equipment, requires minimal time, and can use the opposite uninvolved limb as a control. This test should only be performed when the listed entrance criteria by Hartigan et al. Are met, since this test is very dynamic in nature. First, we must ask, is the triple hop for distance valid? To assess validity, Lagerstedt et al. Examined 85 individuals who experienced an ACL rupture. They were instructed to perform 4 single hop tests preoperatively at 6 months post-ACL reconstruction and 1 year post-op. Sensitivity refers to the probability that the test would detect an actual deficiency. Specificity refers to the probability that the test would not over-report deficiencies that don't exist. Values closer to 1 indicate the best sensitivity and specificity levels. Positive likelihood ratio indicates how much more likely that a patient who tests positive has a deficit, with scores greater than 1 indicating that the patient is not ready for return to sport. Negative likelihood ratio indicates how much less likely a patient who tests negative has a deficit, with scores less than 1 indicating that the patient is ready for return to sport. Ultimately, the triple hop for distance at 6 months significantly predicted self-reported knee function 1 year after ACL reconstruction. For THD validity of non-operative recovery, Grindum et al. Observed 81 individuals undergoing non-operative treatment following an ACL rupture. The area under the receiver operating characteristic curve, or AUC, indicates this test's ability to properly discriminate between the patient with performance deficiency and patient ready to return to sport. This study was not able to find this test to be a valid tool alone. However, when combined with other hop test results, validity of the assessment improved for return to sport. Next, we must ask, is the triple hop for distance reliable? To assess reliability, Reed et al. Observed 42 patients who underwent ACL reconstruction. The THD was performed at 16 weeks post-op for motor learning purposes, and then twice after within the same week to assess reliability. Intraclass correlation, or ICC, is a ratio of the variance between patients to the total variance. It provides an indication of how well a measure can distinguish among patients and can be considered a measure of relative reliability. Standard error of measure, or SEM, provided an expression of an individual subject's hop test measurement error and can be considered an absolute measure of reliability. No research was found on THD reliability for patients undergoing non-operative treatment for ACL injury. However, a study performed by Ross et al. Depicts very high reliability for the THD when performed by individuals with no history of ACL injury. In conclusion, the triple hop for distance test has been proven to be both valid and reliable for patients post-ACL reconstruction rehabilitation and their return to sport. Future research considerations include continuing to assess the THD for patients undergoing non-operative recovery, as well as its validity and reliability for other lower extremity injuries. Also, combining the triple hop test with other single-legged hop tests can possibly increase the validity and reliability in a PT's findings when assessing if a patient is ready to return to sport. Now there will be a video demonstration of the triple hop for distance test. First, we're going to start with securing the measuring tape to the ground as we have here. Some patients may be able to jump much farther than a regular tape measure, so we can use yardsticks or other tape measures, whatever you may have in the clinic. And we're going to start with the patient. We're going to instruct them how to do the test. We're going to instruct the patient to take 3 hops on one leg as far as you can. And for this purpose, we're going to start with the sound leg. So go ahead and stand on your sound leg. And Kevin already did a couple practice trials. You want to do practice trials so the patient gets comfortable with the test. This is a very dynamic test. So go ahead, Kevin, jump as far as you can on 3 hops. And the patient must stick the landing. He cannot have his opposite leg touch the ground either. And from there, we will measure with the yardstick, see how far he can. Again, the trial must be redone if the patient fails to stick the landing. For thorough results, have the patient perform the test 3 times to generate the mean of the 3 trials, then compare to the opposite leg or previously recorded trials.